Derita, derita, derita. Stop, stop, stop. Mukare, mukare. Hop, 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 hop. Don't move, asparagus.
Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in the video today, I'm going to be making a video discussing my family medicine rotation. So I've completed all of my rotations already. I've also graduated from PA school, so I will be making a video about that soon. So thankfully I graduated from PA school, and I've also finished all of my rotations. Very, very grateful to have graduated on time and to have completed my rotations, being that we were out of rotations because of COVID-19. And that was one of my fears, being that we were not going to graduate on time, or I was not going to be able to finish my rotations, and thankfully I was able to finish all of my rotations. So very, very grateful for that. So hopefully this video is helpful for you guys, for those of you who are about to start your family medicine rotation, who are in clinical year, or for those of you who are in your didactic year and are about to start clinical rotations. Hopefully I can share my wisdom and my experience with you guys. When I say wisdom, I don't have that much wisdom, right, because I just graduated, but just a little bit of knowledge I have. So that's kind of one of the reasons why I make these videos, because I know that before I would start a certain rotation, I would always Google it, read on Reddit, see what other students, prior students, or PAs had said about rotations. So hopefully this video is helpful for you guys. So my family medicine rotation, I really loved that rotation. I didn't think I was gonna like it as much as I did, but I loved my rotation. I might consider doing it in the future. For now, I loved doing hospital medicine, critical care, which I'll probably be discussing in another video, but I can definitely see myself doing family medicine also. So how was my schedule? So I did Monday through Friday. My doctor was just kind of like reopening his new clinic, was trying to get back, you know, patients, increase his number of patients, since like he had kind of been closed for a while due to COVID-19. So his hours were a little bit long, so he kind of allowed me to come halfway in between. So I would go in like from 1 to when we saw the last patient, sometimes until 8, 7:30, depending on when we saw our last patient. So that was Monday through Friday. Of course, he came in a lot earlier. He started seeing patients at 8 a.m. But most of the patients that we saw there, since he had a contract with the school districts there, a lot of the patients that we saw were from the school district. So that was another thing that I liked, because I was able to practice my Spanish. We saw a lot of ladies that worked in the cafeteria. We saw a lot of patients that worked, for example, whether it was as janitors, etc. And then of course your teachers and your principals. And most of the ladies that worked in the cafeteria spoke Spanish, and that was the only language that they spoke. Same with some of the janitors. And I really, really like this because I was able to practice my Spanish. I'm fluent in Spanish, but I have to say that my medical Spanish is not where it is supposed to be. It's something that I struggle with, especially when I am describing organs like, you know, the heart, el corazón, los pulmones, the lungs, el estómago, stomach, but certain organs I don't know how to describe them or what they're called in general. Like for example, gallbladder, vesicula. I have to go and ask my mom, like, hey mom, how do you say this in Spanish? So this rotation really helped me use my medical Spanish a lot more. I mean, regardless, being that I'm doing my rotation in the Valley, the majority of our patients there are Spanish speaking, but some rotations I didn't get to speak Spanish as much as this rotation. So I really love the fact that I was able to speak Spanish a lot, and I feel like my Spanish and medical Spanish just improved a lot more in general. And I was able to connect with my patients also a lot, so I really like that, being that my mother is also, she works in the cafeteria also, so I was able to connect with some of the patients that work there. And of course, we saw a lot of patients which was pretty depressing, for depression, generalized anxiety, and this was definitely due to COVID-19. These patients were just depressed because they were at home, they couldn't get out. Same with your anxious patients that had generalized anxiety disorder. They were anxious because they didn't want to go out. They were anxious that they were going to get the virus. They were anxious that their significant other was going to do something to get the virus and get them sick. So I saw a lot of anxiety and depression, and just have seen how much, you know, it has affected our mental health. Because if you see my previous video during my psychiatry rotation, I saw a lot of anxiety and depression also because of COVID-19. But it was it was a lot. My doctor was just booked with patients, not only inpatient hospital, but also in his own clinic, coming in for anxiety, depression, panic disorder. And I saw this a lot in my family medicine. If not, I think we would see more than probably 5 patients every day with either depression or anxiety during my family medicine patient. So it just teaches you how, COVID-19 has affected our mental health. And not only that, I saw a lot of patients that were post COVID-19 that would come in, and how some of these patients have sequelae from having COVID-19. And some of that sequelae is your generalized anxiety disorder. Some of these patients had problem with their lungs. They were just saying they didn't breathe they felt like they didn't breathe like they breathed before. So we saw a lot of that sequelae from COVID-19 in our patients that came into the clinic. But what I have to say that I really liked about this rotation is that you get really close to your patients. And I think that's how it is just generally in medicine, family medicine. You kind of develop this relationship with them. I really like the fact that my doctor allowed me to go see the patients once again, as if I was a provider. And I really sat down with my patients and I educated them, especially if, they had diabetes, a new diagnosis of diabetes, or if they were just not taking their medications or not taking care of themselves or not taking care of the diabetes. I would sit down and just educate them on just the physiology and the pathophysiology of diabetes and what can it do to your organs, what can it do to your heart, your eyes, your kidneys. So I would sit down and discuss this with them, and it was really interesting to see, just when you talk down and sit with them and you explain this to them, it makes them understand and actually want to they want to put effort in their health to make sure that they're getting better. And so I really like that about this rotation, that you're able to sit down and actually do that teach back with your patients, actually teach them about their condition so they can make sure that they take a role in taking care of themselves. Same with hypertension, I really like the fact that I learned about the different types of hypertension medications, which ones do you use in what patients, which ones are more effective in these patients. Same with diabetes, right? Say you've tried metformin, maybe you can switch to another class of medication, all the other new classes of diabetic medications that are coming, right? Your SGLT2 inhibitors, etc. So I really liked the fact that I was able to learn a lot more about my medications for hypertension and then diabetes. Also asthma, we treat a lot of asthma, even diagnose new asthma in patients that are older. So we think about asthma as being a childhood disease, but not really, because it's also found in your older population also. So I really like the fact about me sitting down and educating these patients on what is asthma, what can you do to prevent your exacerbations, etc. How do you take your medications, brush your teeth before you use any of your steroids, etc. So I really liked the fact, just in general, I keep saying, right, that sitting back and teaching your patients on the importance of them taking an active role in their health, that way they can get a lot better. So I really like that about this rotation. I was able to do some procedures. I did some sutures. I had not done sutures since my emergency rotation. And so I definitely know I screwed up that suture, and I kept apologizing to the patient I was suturing. So I was able to do some procedures. I really like that. I struggle a lot with my musculoskeletal exam. So thankfully I was able to get a little bit better with that. I'm not saying 100% better with my MSK exam, but I did improve, since, we saw a lot of patients, like I said, that were from the school district that had chronic back pain or just shoulder pain because of their jobs. Another thing I have to say though, I did not only see how COVID-19 is affecting, of course, just in general, your depression, like we discussed, generalized anxiety disorder, but how is it affecting your teachers, especially the teachers that had to teach online, with students? How is it affecting the bus drivers? So I really saw that part of COVID-19, how some of these bus drivers were displaced from their jobs and they're having to do other job positions that they're not accustomed to. So I had a lot of patients that were definitely struggling with this, and it really made me look at COVID-19 aside from the perspective we look at it now, but a different perspective, like how it's affecting, not only our mental health, but it's also affecting everything. So I really liked that rotation because of that reason. I can definitely see myself going to family medicine rotation just because I really like developing that relationship with your patients, you getting to know them, getting to educate them on the importance of them taking a role in their disease management, taking their medications, educating them about the medication. So that was one of the things I really liked about this rotation. And like I said, another thing with this rotation is that you see everything, you know. You see children, you see elderly. I saw hyperthyroidism, hypothyroidism. We discussed diabetes, hypertension, you saw MSK, asthma. I mean, you see everything. And that's another thing that I like because it always keeps you on your toes. You don't know what you're going to see next. Otitis media, we had patients that would come in and they had active COVID. And so we saw everything. So I really like this rotation. Also, definitely would consider doing family medicine rotation. So hopefully this video is helpful for you. When I came in, I usually wore my scrubs just because, you know, of COVID-19, but my doctor, he would always be in his, he would always be with a nice button-up shirt and khaki pants or just like really nice pants, but I always came in with my scrubs. It just depends on which rotation you're doing, but I was in my scrubs because of COVID-19. It was just something that my program suggested us to do and actually told us to do, is to wear scrubs to rotations just because, you know, they're easier to clean, etc. Alright guys, hopefully this video was helpful for you guys. As always, if you have any comments or suggestions or just topics for me to discuss in future videos, comment below, and I will talk to you guys later. Bye.